Welcome back. I'm Leah Wilson, and today we have a special guest with us, Dr. Brian Schmutzler. He's an anesthesiologist and candidate running for Indiana State Senate. So thank you so much, Brian, for joining me today to talk about your race.
Thank you for having me. Yeah, excited. Very excited.
We're happy to talk with you because you bring something really important to this conversation, which is not just a passion for health freedom and freedom in general, but firsthand experience in the medical system, the thing that affects this whole movement. And so I would love to hear from you as a practicing physician who clearly has a lot on your plate already. What drove you to step into politics and run for state senate?
Yeah, I get that question quite a bit. And so it's not one thing. My grandfather was a state senator in Southern Indiana, county coroner, and sort of kind of bred that into me to be interested in politics. Throughout the years, I was in training, raising kids, building businesses, and didn't really get into it here until the last probably 18 months or so. Spent a little time lobbying for some access and affordability things within the healthcare space. And then really was challenged by my pastor to be more bold and figure out where I fit into things. I started to look at what was happening in COVID, and reflecting on some things that happened in COVID that just didn't make any sense. And then and then kind of moving forward, looked at what the state senate was doing in some ways that I wasn't happy about. And then, to be honest, Charlie Kirk being assassinated got me mad and motivated. And then the final straw were some votes that happened there in December with the redistricting. And at that point, I said, "Hey, I've got to do this." So it was maybe a lifelong process, but at least the last 4 or 5 years were a big part of just getting me into the race.
Absolutely. You seem to, God seems to prepare us for the
Yes.
roles that might pop up. So in Indiana right now, you mentioned that Charlie Kirk's assassination got you mad and motivated. So if you zoom out and specifically in Indiana, where do you feel like families need a stronger voice in government?
Yeah, I mean, I think there's a lot of things that are going on in government. I mean, you start with taxes, and obviously we're a Republican state. We should have lower taxes. But aside from that, I think we had a real assault on medical freedom during COVID with the masking and the vaccine mandates. That was a big deal. I think there's still quite a bit of an assault on school choice, on school freedom, that sort of stuff as well, and what's being taught in our schools. I'm a homeschool dad, so for me, I think it would be great if we could develop that even more in Indiana, where we get a little bit more freedom even to do homeschooling. And I think in terms of and nationwide as well, but in Indiana, what's in our food and water? There's no transparency to that. I've talked a little bit in the past about some of the pesticide issues they're kind of taking the same route that the vaccine industry took, where they're trying to get some decrease in liability or no liability for any issues that they cause. So there's a lot of things going on in Indiana that concern me, kind of from top to bottom. And I don't think our state senators have done a really good job in moving any of those things forward. That we're spending a lot of time debating issues that maybe aren't quite as important to real Hoosiers as those things that we talked about.
It's always amazing to me that we can get away with not addressing how a policy affects the people. And so that's where we really endeavor to bring forward the people's voice to show candidates and people in government what is needed for our families to live free. And something that you might have interesting insights on is this whole medicine being increasingly driven by standard of care protocols rather than individual person right in front of you. And I think people just accept that because it seems like a great idea to make sure we're using the gold standard with every single patient. But from your perspective as a physician, does this need to change?
Yeah, so I've always had a problem with saying X or Y or Z is the standard of care. What I prefer is guidelines, right? We can put out there from whatever society, hey, this is what we recommend as a guideline, but a guideline gives you the flexibility to change patient to patient. Something that I work with in anesthesia is something called a clearance, right? So we say the primary care physician, the cardiologist gave this patient a clearance. What we've worked on in my practice is to change that from a clearance to a risk assessment, right? So for me, it's okay, the cardiologist and the primary care doc say, all right, here's the risk. They're low risk, medium risk, high risk. And then me, the patient, and the surgeon get to make the decision. I feel like across medicine in general, it should be much more driven by patients and physicians, where we use these guidelines out there. Hey, these are things that we maybe recommend, but not these sort of like hard and fast standard of care. You have to do X, Y, and Z.
Else you're punished as a physician, with
True.
your
Yeah.
reimbursement rates, with your status with CMS. So when push comes to shove, a lot of time we see the standard of care become an issue because parental rights take the back seat to standard of care. So, what's your perspective on parents being dismissed from a pediatric
Yeah.
practice for not following a specific path?
Yeah, I mean that's been there's been some things we've decided not to do with our kids that have pushed some of the physicians in my community to be less than thrilled with treating us as patients. Now, I think maybe they haven't kicked us out of the practice because I'm a physician in town, which probably changes their perspective a little bit. But yeah, I mean, I think again, I think that the physicians can say, "Hey, these are the things we recommend, and if you choose not to do them, okay." You told me that's what you recommended, but I'm choosing not to do that, and you shouldn't certainly be fired as a patient. Something that I've advocated for quite a bit is direct primary care, where you've got kind of and we use a functional medicine physician for our physician for my wife and I, and so where you have this direct primary care where really the only people making the decisions are the physician and the patient, and there's really not any insurance involved because I'm paying my money to that physician, and we have that discussion and we do what we want to do. And so all those standard of care guidelines, all those sort of things, those are still in the background, but that's not something that's really getting involved because insurance isn't involved or Medicare or, government. So, but yeah, I mean, kicking somebody out of a practice because they choose not to get, one of the most common things I see, and we've talked about this a little bit on my own kind of personal stuff is the HPV vaccine, right? You should have the option. You want to do it, you don't want to do it, right? This is not a critical vaccine for people, not for everyone anyway. And so I've seen multiple people get kicked out of pediatric practices for not getting the HPV vaccine for their kids at 9 or 10 years old. So I think that's just unconscionable.
Which is fascinating with the HPV vaccine because that shows that these offices were really respecting the CDC guidance on the vaccine schedule. Because in Indiana, HPV is not required for school attendance. It's not a
Right.
mandatory
Right.
vaccine, but I guess that shows that, one of the most egregious examples of standard of care is the 72 dose, one size
Yeah.
fits all vaccine schedule. Stand for Health Freedom is currently suing the CDC because the schedule has never been studied in its entirety. So each
Right.
dose together synergistically, despite the Institute of Medicine asking for decades for this very type of research to be done by the CDC. So, what do you think of the whole schedule not being studied? Should we win our lawsuit to move this down to shared decision making instead of every 3-month-old has a default and the government has an opinion about it?
Yeah, I mean, having not been studied, each individual one, not every individual vaccine has actually been studied either, right? So the combination hasn't been studied for sure, but each individual one, there were only I can't remember the number, but only a percentage of them have actually been studied. And then again, we know that the vaccine companies have full immunity from any side effects, any detriment to society that these vaccines cause. So no, I'm 100% for studying them. I'm also for giving patients choices, right? So, okay, here's the positives and negatives. Here's the risks and benefits. This is what I do all day, every day, right? If you're going to have surgery, here's the risk, here's the benefit. Do you want to have the surgery or not? I think we should do the same thing with the vaccines. Okay, here's your risk, here's your benefit. Do you want to do this or not? I think public health gets in and kind of manipulates things in a certain way sometimes that takes away that choice, takes away that risk benefit discussion from patients.
Public health has creeped in so big that we talk to moms who tell us, "Oh, Leah, I didn't know I could tell my pediatrician that I didn't want that shot." And I'm thinking, what do you mean that you didn't know you could say no? And that's obviously an issue with the doctor not presenting a decision,
Right.
just
Right.
presenting a standard that quote unquote must be followed. And that probably covers the doctor to an extent because you're doing what the medical establishment told you to do, right?
Right, right. Yeah, I mean, so the problem is a bunch of these societies, especially the American Pediatric Association, APA, right? American Pediatric Association or AAP. Anyway, the American Academy of Pediatrics, right? AAP. They've really pushed this, and you have to understand. So there are some physicians who are public health experts, have masters in public health, but public health is not a physician discipline, right? So people making these decisions while they may have a degree in public health, they don't fully understand physician patient relationship. They don't fully understand physiology, biology, all these other things. So, is there a place for public health? Probably. But I feel like most of the public health experts, everything is the sky is falling, right? If you look back at Anthony Fauci's history, every time there's any sort of an infectious disease that appeared on the scene, it was the end of the world. We got to shut everything down. I mean, he said this over and over and over again. You can look at some of the tape from his discussions, but going all the way back to the so while I think we should consider public health, when they make recommendations, I think we should look at what they're saying. I don't think that's the end all be all. I think again it goes back to doctor patient relationship.
I mean, it is a dance between what's currently happening and the vision that we have for the
Yeah,
doctor and the patient to actually be able to make a good decision.
right.
Zooming out a little bit, if
Sure.
elected, what's the first thing that you would want to work on?
Oh, wow. So I'm a fiscal conservative too. So I think cutting taxes is probably the big broad issue I want to work on. But I think there's a lot of things that we can do in the healthcare space. I mean, I would be in favor of preventing any mask or vaccine mandates going forward, right? So we did something really poorly during COVID, which is we allowed the governor and I'll be honest, I know a lot of the public health people who are around just because of some connections. We let them kind of drive our decisions. We have a super majority of supposedly freedom loving conservatives in Indiana, and we should have been Florida, right? Florida kept things open. They didn't force masks. They didn't force vaccines. We should have been that. So, I mean, I would certainly be willing to put together a resolution to prevent a governor. And, I think Governor Braun is a freedom loving guy. So I don't think he'd be the one to do it, but who knows who the governor will be at some point. And I've said this over and over again. We should not mandate masks. We should not mandate vaccines. And we need to make sure that that's codified into our law.
How do you approach the role of state senator differently as a physician than a career politician might?
Yeah, so I think that I'm trying to remember the exact number. I think it's maybe 40% of our total operating budget in the state of Indiana is related to healthcare, and we currently have one physician in the entire General Assembly now that Barrett's retired, and that's Senator Tyler Johnson. So I think there's people in this system that are making decisions for healthcare, the healthcare of our entire state, and health policy for the entire state, insurance, medical freedom decisions, who have zero experience in healthcare. So, I mean, I'm going to approach this in a way that I am an expert in healthcare. I'm an expert in health business. Actually, I run my own company. I've had to deal with insurance companies. I've had to deal with governing bodies and national and state issues. So, I mean, I think for me, I'm approaching this as I'd like to work with Tyler and some of the other people on the health committee to really drive healthcare in Indiana and make Indiana the leader in not only medical freedom but in access and affordability in ways that reduce sort of the outside influence of a lot of organizations and even we can do some things that even limit the ability of the federal government to demand certain things for us. So I have a real interest in driving that.
Well, it's refreshing to hear that someone wants to take a lead and not wait on the federal government because our constitutional structure was originally that the federal government
States'
would
rights.
represent
Yes.
and protect us as the 50 states. And so we cannot wait. So, what's your plan to stay focused on what actually matters to your voters in the district?
Yeah, so I'm knocking doors. Thousands of doors so far. I can't remember the exact number. I'd have to look. I've knocked a ton of doors. And so staying connected one-on-one with the voters is important to me. We're doing some town halls, we're doing some discussions, just kind of one-on-one. So that's keeping me grounded. Controlling the things I can control. Again, for me, that's having discussions like these. That's going out and meeting the voters. Accessibility wise, I mean, I plan to be the most accessible candidate and then the most accessible state senator out there. So I mean, I share this with everyone, but I give my personal cell phone number to all my patients. And when I'm out talking to people on the campaign trail, I give them my personal cell phone number. They can call me, text me anytime. I don't sleep a ton, which is probably something I should work on, but I'm pretty accessible. And so if anybody wants to talk to me, I've had multiple people reach out via phone and text, giving them my phone number. So I think accessibility is huge. I think that keeps me grounded. I try to stay away from a lot of the, you know, political noise where people are saying you should do this or you shouldn't do this or, your opponent does this. Why don't you do this? Like I just I try to keep it as grassroots as possible, and I think that keeps me grounded. And then just spending time with my family as much as possible and spending time in prayer, big for me as well.
The voters in Indiana who are just now learning about your campaign for state senate, where can they go to learn more and to get involved? Because this is a grassroots endeavor.
Yeah. So it's Dr. Brian Schmelzler for Indiana.com. And then we're all over social media. If you look up my personal social media page, I'm the self deprecating anesthesiologist. So you may have seen me on that before. But we do have the Dr. Brian for Indiana Senate on Facebook, Instagram, and X. So you can look us up there. And then we have an email and a phone number on the campaign website as well. So please feel free to reach out. I read every single one of those texts, every single one of those emails. And I often respond via my own personal cell phone or my personal email address. So we use the campaign email to weed out the people who are cussing at me and yelling and screaming and telling me to take a flying leap. But real people who ask real questions, I answer them. So,
Absolutely. Well, Dr. Bryan is running for Indiana State Senate in District 11. So if you're in Northern Indiana and you care about health freedom, this is a race to watch. And Dr. Bryan, I just want to say thank you so much for joining us. Thank you for running to bring in a greater awareness of what's plaguing the healthcare industry right now and how we can make that better for Hoosiers. So thank you so much.
yeah, my pleasure. And thank you so much for your support. I appreciate the endorsement. And I'm gonna do everything I can to make you all proud for endorsing me.